Metformin has long and firmly occupied the position of the first-line drug in type 2 diabetes mellitus. With the advent of gliflozins or sodium glucose cotransporter 2 inhibitors on the pharmaceutical market, the idea arose to replace metformin with empagliflozin, ertugliflozin, and canagliflozin. An important advantage of gliflozins over other anti-diabetic drugs was considered not only a low risk of hypoglycemia but also improved outcomes in heart and kidney diseases. But with gliflozins, as they thought, it did not work out, at least in comparison with metformin. A study in a large cohort of patients with type 2 diabetes showed no difference between gliflozins and metformin in terms of overall cardiovascular risk. At the same time, those who took gliflozins were twice as likely to have a genital infection as a complication. At the same time, and this is especially important, therapy with these drugs compared with metformin cost 50 times more expensive. Therefore, we need to have in mind metformin as a first-line therapy for type 2 diabetes mellitus. By the way, it has many additional positive effects that gliflozins never dreamed of, such as anti-cancer, anti-inflammatory, anti-atherosclerotic, and so on. You can learn a lot about this from my videos on this channel. Who is armed is protected. Take care of yourself and be healthy.